Hello everyone, I'm Dr. Prateek Joshi. Today we have a case of a middle-aged female patient who had a medial compartment pain. On X-ray there was a good medial compartment space, and on scanogram there was no significant varus deformity. On MRI patient had medial meniscus posterior root avulsion injury, and you can see on the diagnostic arthroscopy there is a complete posterior horn medial meniscus avulsion. So first we are going to use a jig to drill our guide wire through the footprint of the posterior horn of the medial meniscus. On top of this guide wire we are going to drill with end over turn drill bit, and I am protecting the guide wire with the scoop so that the guide wire doesn't progress posteriorly. Medial meniscus posterior root avulsion is the beginning of the medial compartment osteoarthritis. If we repair this injury, there is less chance of progression of the medial compartment osteoarthritis. So now I am going to take bites through the posterior horn of the medial meniscus with the help of suture passing device. We usually do medial collateral ligament pie crusting in order to open up the medial compartment so that we can introduce our suture passing device through the anteromedial portal. So as you can see, I have passed my loop through the posterior horn of the medial meniscus. The suture material is number 2 fiber wire. This is the strongest configuration of the suture, which has the least chances of cutout through the meniscus substance. Our first bite, which you can see was with the help of black suture, is slightly more at the periphery of the meniscus, so we removed that suture. We are going to pass another suture through the substance of the posterior of the medial meniscus, slightly medial to the first suture that we have taken. So this is going to be our second suture through the substance of the posterior of the medial meniscus. So now we are ready to pass these sutures through the tibial tunnel, for which I am going to introduce bit pin with the suture loop attached to it, and I am going to shuttle both the threads through the loop, and then I am going to pull the bit pin with the suture loop so that both the sutures that we have taken through the substance of the posterior horn of the medial meniscus go through the tibial tunnel and come out from anterior aspect. So now you can see that the posterior root of the medial meniscus is very well reduced to its footprint. There is also a small anterior horn of the medial meniscus tear which we are going to repair with the help of outside in sutures. So you can see that I am passing my sutures in vertical mattress configuration, and this I am going to tie outside, and this is going to repair the anterior horn of the medial meniscus. In initial days, meniscus was thought to be not so important structure in the knee joint, but now we know that meniscus is very important structure in knee joint because it provides concavo-convex surface in the knee joint, and because of this property it distributes the stresses on the joint evenly throughout the joint surface. So whenever the meniscus is torn or it is displaced from its position, there will be increased stresses through the joint surface, and it will increase the speed of osteoarthritic process in the knee joint. So now we have repaired both the anterior horn of the medial meniscus and the posterior root avulsion of the medial meniscus, and this is the final picture after the repair, and this patient is going to do well after this procedure, and we hope that the osteoarthritic process is going to slow down in this knee joint, and this patient will have good functional knee joint for long duration. Thank you for watching this video. Do like and share the video, subscribe to the channel. Thank you.